Hey everybody, welcome back to Linnea Nelson Vlogs. I'm Robert and this is Linnea. In today's episode, Linnea is going to get retested and reevaluated for SIBO at Duke Gastroenterology's North Clinic in Durham. So we're going to show the SIBO test and give facts about SIBO, and at the end of the video we're going to interpret Linnea's results and compare them to her previous results from last year.
So let's get into the video.
According to the Mayo Clinic, small intestinal bacterial overgrowth, or SIBO, occurs when there is an abnormal increase in the overall bacterial population in the small intestine, especially when the species are non-native to the small intestinal microbiome. There are many risk factors for SIBO, but these risk factors can largely be divided into two categories: motility-related and bacteria-related. Conditions that affect the structure and motility of the intestine include adhesion scars from surgery, intestinal diverticuli and strictures, and gastroparesis or small bowel dysmotility. When these are present, they disrupt the migrating motor complex necessary for the peristaltic movement of food and waste of the small intestine, which normally dilutes out bacterial populations. In contrast, SIBO can also be initiated when food poisoning introduces new pathogenic bacteria to the small intestine, antibiotics disrupt the normal microbiome, gastric acid is suppressed to prevent reflux, or in response to other organ system dysfunctions such as Crohn's disease, celiac disease, or diabetes. SIBO is most commonly suspected as a diagnosis when a patient presents with some combination of loss of appetite, abdominal pain, nausea, diarrhea, severe bloating, and unexplained weight loss. People with SIBO might notice sensitivities to sugars found in fruits and vegetables known as FODMAPs, or fermentable oligosaccharides, disaccharides, monosaccharides, and polyols that the bacterial overgrowth feeds on. The diagnostic test for SIBO involves intentionally exposing possible SIBO patients to a FODMAP known as lactulose, and then measuring fermentation byproducts such as methane and hydrogen in their breath. Elevated hydrogen is associated with bacteria that cause diarrhea, and the less common case of elevated methane is associated with bacteria that cause constipation. After collecting multiple hours of measurements, a gastroenterologist will interpret the results to diagnose the patient with hydrogen or methane-dominant SIBO.
Y'all, guess who is SIBO free? This person. They can't make a SIBO diagnosis if the highest any of my gases got was 7. You have to have a 20-point jump. Y'all, I am SIBO free. I have no idea how I cured it. I have a few theories and that'll be covered in a different video, but my gases barely moved. My methane only got as high as 1. And last time my methane got as high as 10 at the end. My hydrogen only got as high as 7, and that wasn't until the very last breath of the test. It was 0. My gases were 0 almost the entire time. Your girl, Robert freaking called this. He was like, you know what, Linnea, you don't belch anymore, and you don't bloat anymore, so you're probably SIBO free. And he called it. He was right. I'm SIBO free. I'm the sickest that I've ever been, but I'm SIBO free. So someone needs to figure that out.
Yep, and we'll do a comparison when the results come back in between the previous test and the new test, and do a breakdown of what all the actual criteria are according to European and North American standards once we get home.
Yes, we will. Stay tuned for that part of the video.
Diagnostic standards actually differ substantially between Europe and North America. I will explain these in the context of Linnea's test results from 2022 and 2023. First, the doctor will assess the baseline levels of hydrogen and methane. If the patient has a baseline hydrogen above 20 parts per million, it indicates that the patient did not prep correctly and will need to return at a later time. In both cases, Linnea prepped correctly. Next, the doctor will assess the change in hydrogen levels. A patient can be diagnosed with hydrogen-dominated SIBO if they show an increase of 10 parts per million hydrogen in 60 minutes by European standards, or by 20 parts per million within 90 minutes by American standards. Linnea's 2022 test shows that she would not qualify for a SIBO diagnosis by European standards at 60 minutes because she only had 9 parts per million of hydrogen. However, she was diagnosed with hydrogen-dominant SIBO by American standards because she had 42 parts per million at 90 minutes. In contrast, Linnea's 2023 SIBO test only showed an 8 part per million change in hydrogen, indicating that her SIBO had been cured. Next, the physician will check methane levels. If the patient shows an increase in methane of greater than 10 parts per million during the test, they will be diagnosed with methane-dominant SIBO. In both of Linnea's tests, her methane levels did not cross 10 parts per million. Therefore, she could not be diagnosed with methane-dominant SIBO. In rare cases, some patients show a pathological amount of hydrogen, but it does not peak after 90 minutes. This can imply that their gastrointestinal transit speed is extremely slow, or that hydrogen sulfide-producing bacteria may be the cause of the SIBO. However, hydrogen sulfide is not commonly tested for at most sites that provide SIBO breath tests.